There are many patients with widespread body aches and other symptoms who are diagnosed as having fibromyalgia. And then there are patients who have Lyme disease or are treated for Lyme disease who develop similar symptoms. But because these symptoms are similar in the two conditions, it is difficult to differentiate them. And this leads to a lot of confusion. In this video, we'll examine ways to differentiate between these two conditions. There are many patients who suffer from body aches and pains and brain fogging and fatigue and sleep disturbances and headaches who are then diagnosed as having fibromyalgia by their physicians. But there's a group of patients who have either been exposed to the Lyme disease pathogen or who have been successfully treated for Lyme disease, who then go on to develop a syndrome with these exact same symptoms known as Post Lyme Disease syndrome or Post Lyme Syndrome. Now, the differentiation between fibromyalgia and this Post Lyme disease is difficult. And the reason is that we do not have a single test that we can run to differentiate one from the other. So that these two conditions can be indistinguishable at times and are easily confused. But you may ask, why is this important? Well, it is important because the treatment of these two diseases is different. Fibromyalgia requires a lifestyle intervention focus that introduces the patient to lifestyle changes such as exercise training or strengthening exercises, coupled with cognitive behavioral treatments to improve their sleep hygiene. And drugs that are used to treat the pain in post-Lyme disease syndrome may not work in fibromyalgia, such as the glucocorticoids or the non-steroidal anti-inflammatory drugs. Instead, we use centrally acting drugs such as antidepressants from the serotonin norepinephrine reuptake inhibitor class. Now, this is important because if we use the wrong treatment to treat either of these illnesses, this can lead to patient frustration and unnecessary suffering. For that reason, it is desirable to differentiate between these two conditions. Differentiating between these two conditions, however, is not a simple task because we do not have a simple blood test that we can run to differentiate between the two illnesses. It is true that we can run Lyme titers to detect antibodies for Lyme disease in the blood of patients, but that is not very helpful. Many patients rapidly lose their markers in the blood for Lyme disease after they have suffered with the illness. Or there may be patients who have positive Lyme antibodies in their blood, but have never had any symptoms of Lyme disease. Or maybe they did in fact have Lyme disease, but were successfully treated, but have retained the antibodies, the markers in the blood, permanently for Lyme disease. So how can we tell these two diseases apart, these two conditions? Fortunately, there are subtle differences between them that can help to guide us towards making the right diagnosis. Patients with fibromyalgia tend to complain of pain all over the body, whereas patients with post-Lyme disease syndrome usually have pain in a localized area. Fibromyalgia pain also tends to occur in the central areas of the body, such as the neck and the chest and the back, whereas post-Lyme disease syndrome tends to occur in the extremities. The pain of post-Lyme disease syndrome tends to occur on one side of the body. On the other hand, pain in fibromyalgia is usually symmetrical and occurs both above and below the belt. Patients with fibromyalgia find it difficult to localize the pain, and the pain in fibromyalgia does not migrate the way pain in post Lyme disease syndrome does. Patients with fibromyalgia often complain of anxiety and depression and bowel pain and pelvic pain, which are rarer in post Lyme disease syndrome. To complicate matters even more, Lyme disease is often followed by fibromyalgia, and there are some scientists who believe that Lyme disease may actually trigger fibromyalgia. Until we have a simple blood test that we can run to differentiate between these two conditions, they will continue to cause headaches when doctors try to differentiate between them. But with a careful history and close observation, an accurate diagnosis can be made. Thank you for watching the video. I hope this was informative. I hope you enjoyed it. Please like, leave your comments in the box below, and subscribe to the channel so that we can continue to bring you interesting topics in medicine. Until the next video, stay healthy and stay safe.